Hi and welcome. My name is Erica Kafka. I am a physician assistant and yoga therapist. I am here today to share with you a breath practice, otherwise known as pranayama or pranayama in the world of yoga. Breath practices are one of my main go-to tools for my own self-care and also for my clients, my students, my patients, my family, and my friends. Having awareness of our breath and access to manipulate or control the breath is one of the things that can really help an individual shift from one state to another. So for instance, if someone's feeling angry, frustrated, irritated, overwhelmed, and they're able to subtly begin to come into awareness of their breath, and then maybe they take a deep breath in, perhaps it's even just out of exacerbation, and then they let it out, there is a very subtle shift that starts to happen in the body when the breath is activated in that way. It allows not only the body to sort of begin to soften, but it allows the mind to move into a new state of being, right? And if you take and you do a deep breath a couple of times, most often people start to feel into a different space. It might not necessarily feel better right away, but they start to notice a little bit of a difference. Breath is also an incredible tool for our physical well-being. So as we learn to increase and control or deepen the breath, the things that start to happen inside of our body are really extraordinary. So when you work on your breath practice, one of the things that happens is you start to build what we call lung capacity or lung strength. You're able to actually breathe with more fluidity, with more depth, with a little bit less tightness and restriction. It starts to allow the lungs to be more pliable, if you will, right? Like you create more room inside of the lungs. The other thing that's happening is that there's these muscles of respiration that assist in the process of breathing. And as you work with the breath, you start to build the endurance of your muscles of respiration. So one of the big ones that we talk about is the diaphragm. It's underneath the rib cage, just below the lungs, underneath the rib cage, and that is really the main muscle. There's also muscles in between the rib cage and muscles up here around the clavicle, the chest, the throat area that really assist in respiration. And as you become more comfortable and aware of, and you start to deepen that, you really build those muscles. The breath practice that we're going to do today is called a 3-part breath. This breath is an amazing breath to build your lung capacity, to strengthen the muscles around that assist in breathing, and then to also help with the mind, right? So with these overactive thoughts that we may have, or repetitive thoughts that we may have, or the anxiety sensations and fear sensations that come up. 3-part breath is a breath that we use often and commonly, and the way I'm going to teach this today is actually in the 3 parts, and then we'll put it all together, and then we'll do a couple of rounds all together. A couple things I want you to know before we begin. 1, meet yourself where you're at. Always, always, always honor where you're at, how you're feeling today, how your body's feeling today, what the breath feels like today. There may be days when 3-part breath doesn't really work for you. There may be days when it feels like the best thing ever. So just really be kind and loving to yourself and know that it's totally okay to be just where you're at and not have to do anything different than what you can do right now. The other thing is that if something isn't accessible to you for a physical reason, or maybe just because it just doesn't feel right in the moment, you always can visualize. Visualization is such a powerful tool, and I use it all the time when I'm working with individuals. So you can simply visualize this. As we work through these three parts, we're going to work with our belly, our chest, the mid part of the chest, the thoracic spine area, and then the upper chest around the clavicles. It's absolutely fine to visualize. I want you to take care of yourself, honor yourself, and know that never is nothing not happening. Something's always happening, and in a really positive way. Good. So I'm going to teach you in 3 different steps this particular breath. So 3-part breath is what we do is we divide it by parts of the body. So the first part of this breath is an inhalation through the nose. And as we inhale through the nose, what happens is the diaphragm starts to drop down, that muscle underneath the ribs. And as the diaphragm drops down, the belly naturally starts to move outward. I'm going to shift my screen just a little bit here. So I'm going to move the screen so you can see my belly moving. So as you inhale, what will happen is you'll take a deep inhale through the nose, and you allow the belly to move outward. So I'll exhale and see how the belly comes in, and then inhale. And the belly protrudes outward. Now, this may be a little difficult for some of you. This may not be accessible for some of you. It's okay. Again, remember, visualize. The other thing is to don't take yourself too seriously. If the belly wants to move in an opposite pattern, that's oftentimes normal. So just let it, and as you work into it, it'll find its pattern. You may have to think a little bit more, concentrate a little bit more, and that's okay. So do that. So we'll do that 2 times. Okay. So just take a deep breath in, open the mouth, exhale it out. Good. Let's one more time. Deep inhale in, open the mouth, exhale it out. Good. Now this time, as we inhale, I want you to really feel the belly move outward. So inhale and let the belly expand outward. Beautiful. Then exhale. On the exhale, the belly moves inward and the navel or the belly button comes towards the spine. Good. Inhale, fill the belly up again. So allow the belly to move out. And then exhale, belly relaxes in. Excellent. Good. So that's the first part, the belly. We often call it belly breathing. Just a little caveat here. Technically, physiologically, you can't really breathe into the belly, you breathe into the lungs. But from a yogic standpoint, we talk about when we say pranayama, prana is the life force energy. And so what we're meaning to when we say breathe into the belly is this energetic or esoteric sensation that the breath is that life force is moving, and we're moving it into the belly. Okay? Good. Now, the second part of the breath is to breathe into the rib cage, right? So this lower part of the rib cage, the lower ribs, and through the thoracic area, the middle of the chest. So it's a little bit more concentrated. Again, I'm going to tilt my screen just a little bit. So we'll inhale. As you inhale through the nose, the ribs go out, and then exhale. See the ribs come in. Inhale. And then exhale, and the ribs come in. Good. So again, if it works for you to be able to feel into that and do that, if it doesn't, just simply breathe. That's okay. Good. So we'll try that. So we'll just take another deep breath in. Open the mouth, exhale. Let it out. Good. And now, one more inhale. Exhale. Let it out. Good. And then we'll concentrate the breath into the rib cage, into the lungs, okay? That lower portion. So as we inhale, feel the ribs expand, side of the ribs expand, and then exhale. Feel them start to move back in. The ribs get a little closer together. Good. And then inhale. Feel the ribs start to move apart as the lungs expand, opening up through that lower chest. And then exhale, feel the lungs start to release the air and the ribs come back in. Beautiful. Good. So that's the second part, right? And then we'll move into the third part. So the third part is to breathe. This one can be, it just depends on how your breath pattern is. It can feel a little awkward at first. If you're used to breathing up here, it might feel really normal. So what we do is we breathe in to the area here where the collarbones are, this upper portion of the chest. So you have a little bit of the lung that actually comes up above these bones here. So that's where we're aiming to. So we're going to fill the lungs up. You may actually feel your shoulders rise a little bit. That's okay. You may feel the body want to sort of, the sensation of lifting. Those of you that don't have the movement in the shoulders, it's okay. You don't have to necessarily sense or feel it. It's just the idea that you're feeling this sort of the top part of the lungs, right? So it'll look and sound a little bit like this. So inhaling. Exhale. Good. Inhaling. Feel it up here in the chest. See how my collarbones start to come up. You see a little bit of contraction through my muscles here. Good. And then exhale. I let it out and you see how my shoulders soften. Good. So we'll do that now. We're just going to take one breath to sort of set us up. So take an inhale. Exhale. Good. Let it out. And then we'll practice this upper chest breathing. So inhale. Feel the collarbone start to rise a little bit, stretching through the upper chest. Good. Exhale, soften, letting it out. Good. One more time. Inhale. And exhale. Good. And sometimes it's hard to really separate movement in the lower part of the chest from the upper part of the chest. Totally fine. Just know that that's where the concentration is, like that's the what we're in. So now we put it all together into all three parts. So it will go inhale, you let the belly and then the chest and then the upper chest expand all in one breath. And then as we exhale, we'll reverse the order. So it'll go, we'll call this upper chest, ribs, belly, okay? And there is another way to do it where you can do same way in and same way out, but we'll go inhale, belly, ribs, chest, exhale, chest, ribs, belly, okay? Good. So come into some softness through the body. Maybe you take a couple of cleansing breaths here. As you prepare yourself to move into a concentrated breath practice, the eyes can gently close and the gaze drift upward to the third eye if that feels comfortable. If not, simply leave the eyes open, soften the gaze. Either down maybe at the tip of the nose or towards the floor. Maybe you have an object you enjoy looking at. Just allow the eyes to be soft though. Good. And we'll start by inhaling. As you inhale, let the belly rise, and then the ribs, and then chest. And then exhale, chest, ribs, belly. Inhale, belly, ribs, chest. Exhale, chest, ribs, belly. Inhale, belly, ribs, chest. Exhale, chest, ribs, belly. Inhale, belly, ribs, chest. Exhale, chest, ribs, belly. Inhale, belly, chest, ribs, chest. Exhale, chest, ribs, belly. Continue in your own rhythm for a few more rounds. Inhaling, belly, ribs, chest, and then exhaling with the chest, ribs, and belly. Really feeling into the expansion of the abdomen, the belly. Feel into the expansion, the openness of the rib cage. And then feel the movement of the clavicles. And then on the exhale, feel that relaxation. Feel the softness come through the clavicles, the sternum. Feel the ribs start to move back in, and the belly moves inward towards the back of the spine. Again, at any point, if the 3-part breath is not feeling smooth or easy to work through, simply just move into equal breathing, breathing in and breathing out. And you can notice what moves as you breathe in and what moves as you exhale out. Good, and then we'll come back together by taking a deep inhale. Open the mouth, exhale. Good, keep the eyes closed or the eye gaze softened. And just notice after those few minutes of consciously breathing the breath, how you now feel. Notice the difference in the body, in the mind. Maybe even notice into that field around you, something we call our aura or our auric field. Can you begin to sense into the energy that's surrounding you, your energy, your life energy, your light that's so very bright. And your light, your unique light that is so needed in the world today. Feel into that, and then feel into your heart center. And take a moment to acknowledge yourself, acknowledge the beauty of who you are, acknowledge the beauty of what you have to offer, and know that you are absolutely perfect, just as you are. Deep inhale in and deep exhale out.